Thank you, Madam President. I rise in opposition to this nomination. I agree with my colleagues on this side of the aisle and with Senator Krueger in terms of the credentials that, that Dr. Bassett brings to the table, if you will. They are without question impressive. She's eminently qualified in terms of credentials. And listening to Senator Jackson, my good friend, speak from a personal point of view in terms of knowing her as a good and honorable person, well, if Senator Jackson says so, that's good enough for me. I take him at his word. And those are important qualifications for anyone we consider in terms of serving the state of New York and the people. But as Senator Boyle mentioned and Senator Borrello, perhaps the most important function from the Commissioner of Health in the state of New York is to set policy concerning health. And, you know, by the numbers, in terms of what has happened during this pandemic here in New York, the New York State Health Department has failed the people of New York miserably. The Department of Health here in New York has done a better job destroying businesses and families than it has destroying the COVID virus. The Department of Health and the administration's policies over the last 2 years has done a better job in depriving students from one end of the state of New York to another from an adequate, safe, fair, quality education than it has in saving lives. And listening to Dr. Mary Bassett, she's telling the people of New York that not only is she not going to alter the course in terms of policy here in New York concerning the COVID pandemic, but she's going to double down with mandates that have failed the people of New York. Double down on vaccine mandates for 5-year-olds and 6-year-olds, as Senator Boyle said, for students all the way out to September when we don't know what's going to be happening with this pandemic. But here's what we do know today. In New York, over the last several months, we have seen record numbers of COVID cases. That is after all those mandates. That is after the majority of the population being vaccinated. Before vaccinations, we had a number of cases. After vaccine mandates, the number of cases in New York have exploded. You cannot get around those numbers. It seems to me that intelligence would dictate that we analyze what it is we're doing, because what we are doing is not working. By the numbers. We've had an explosion of COVID cases here in New York. Record numbers of cases. And she wants to keep doing exactly the same thing, which clearly is not working. And there's one thing that has been mentioned that, for me, perhaps even stands above all that in terms of why I unfortunately cannot support this nomination. The number one cause of death for people under the age of 50 in the state of New York is not COVID, not by a long stretch. It's drug overdose. That is what is killing New Yorkers every single day. And we've become a sanctuary state for, among other things, fentanyl, which is taking more lives every single day. And it's usually people who are just at the beginning and the start of their lives. And so what does the Commissioner, the soon-to-be Commissioner of Health, want to do about that? She wants people to be able to walk into an office and be handed a needle by the government of the city of New York and the state of New York and be allowed to put poison in their arms. While the good government of the state of New York, the good health department of the city of New York, the good health department of the state of New York stands by and watches. One of the reasons I've heard in support of this policy is because at least we'll get them off the street. I guess it's a little tough to look at if you live in Manhattan. You don't want to really be bothered by the prospects of walking past someone who is in the throes of addiction, who more than anything else needs you to help them, needs the health department of the city of New York and the state of New York to help them, not tuck them away, out of sight, and give them poison. And then I had to cry after the first day that that sick center was opened, that the people who support it, like Dr. Mary Bassett, cried victory. Because in the first day, they said, 5 people were saved. Here's what they define as saved. 5 people under supervision in these needle sites overdosed, convulsed, were seconds away from dying, all under the watchful eye of the state of New York's Department of Health, all under the watchful eye of these compassionate supervisors. And so they administered Narcan, and they saved them, they picked them off the floor, and they said, what a success. Dr. Mary Bassett, the New York City Health Commissioner, the state of New York, is effectively saying, if you're struggling with addiction, we've given up on you. You don't matter enough for us to roll up our sleeves and save your life. Go and die. Just die with a clean needle. This alone, to me, says the world is so upside down that perhaps we are lost in the state of New York. But we can't keep doubling down on things that don't work. And we can't give up on each other. And we can't tell people, you're addicted, here's a clean needle, go put poison in your arms. And that's what Dr. Bassett is saying is okay. And of all the reasons, for me, that is the primary reason why I, unfortunately, Madam President, cannot support this nomination.